Welcome to the session on establishing an Emergency Response Sanitation Unit, also known as ERSU. Hi, I am Rajesh Pai. I work at Wash Institute as Director Capacity Building. In this session, we will look at why do we need an Emergency Response Sanitation Unit? Who can constitute an ERSU? What are the roles and responsibilities of constituent members and how to set up a functional ERSU? The Prohibition of Employment as Manual Scavengers and their Rehabilitation Act PEMSRA was introduced to eliminate hazardous practices like the manual cleaning of sewer lines and septic tanks. However, despite the ban on manual scavenging, India still reports numerous fatalities linked to sewer and septic tank maintenance. The primary causes of these deaths are the lack of personal protective equipment, insufficient training of workers entering a confined spaces, and lack of adherence to safety protocols by both operators and supervisors. In line with the Sustainable Development Goal 6, India has been enhancing its sewer systems and septic tank infrastructure. Keeping in line with acceptable practices, we need to ensure that only trained and skilled professionals handle sewer cleaning and maintenance. These specialized teams, known as the Emergency Response Sanitation Units, also known as ERSU, are essential for managing such high-risk tasks safely and in compliance with the regulations. The ERSU is permitted to manually enter sewers in specific situations such as removing damaged access covers where mechanical equipment is ineffective, connecting newly laid sewers to existing lines, reconstructing access points, or repairing the sewer line. In such cases, it is mandatory to engage only experienced and skilled professionals for the ERSU who have received specialized training to safely perform these tasks. There may also be situations where manual entry may be absolutely required as a last resort. To prevent fatalities caused by untrained sanitation workers entering sewers and septic tanks, ERSUs are established. The unit will be led by a Responsible Sanitation Authority, also known as RSA, which could be the district magistrate or municipal commissioner. In cities where entities like the Jal Board or sewerage agencies manage a significant portions of sewers, their CEO or regional head may be designated as the Responsible Sanitation Authority for that jurisdiction. Here is the flow chart outlining the constituents of an ERSU, detailing who they are and their role for the Emergency Response Sanitation Unit. The Emergency Response Sanitation Unit is led by the District Collector or Commissioner of the City Corporations, who takes overall responsibility for the team's operations. As the Responsible Sanitation Authority, they are empowered under relevant acts to act as a single authority within their jurisdiction. Their role is crucial in safeguarding public health, environment, and safety. Let's grasp the significance of RSA's responsibilities. RSA not only identifies and selects the ERSU staff, but also ensures that it is equipped with 24/7 contact number. RSA have to procure the appropriate safety gear and equipment as described in the ERSU guidelines. They must ensure that the ERSU teams undergo comprehensive and rigorous training. RSA also need to establish regulation to prevent households and establishments from using unauthorized persons from manual cleaning. They must establish protocols for communication, coordination, and action for efficient operations on ground. Lastly, they must ensure that the ERSU operations are continuously monitored and contextual changes are made to ensure that protocols are effective and worker-friendly. The duty supervisor in Emergency Response Sanitation Unit is typically an engineer or sanitary inspector. Their roles are crucial and multifaceted. They must immediately reach the site of any sewer or septic tank overflow, evaluate and identify hazards before entry, and request written permission from the responsible sanitation authority to prepare for sewer entry. Additionally, they must verify that conditions are safe for entry, oversee the entire sewer or septic tank entry process, and report the completion of the task to the RSA. Sewer entry professionals, also known as SEPs, are preferably selected from traditionally employed sanitation workers. Their role is critical in ensuring safety during sewer and septic tank entries. SEPs are thoroughly trained to understand the hazards associated with confined space entry, particularly those specific to sewers and septic tanks. They are the authorized persons to enter into confined sanitation spaces. Once inside, they should be able to carry out the required maintenance activity and, if necessary, rescue persons or animals if any. They must, therefore, be able to operate any equipment which is required for the safety, entry, or maintenance. Here are the steps to set up an ERSU. Let us look at the steps one by one. Step 1 is to set up Responsible Sanitation Authority. It begins with the state governments identifying and nominating RSAs who may be the district collectors or municipal commissioners. The appointed RSAs then identify additional positions from existing staff within the urban development or public health engineering department. Additionally, the RSA specifies the jurisdictional areas typically within a 75-kilometer radius. Step 2 involves identifying the number of ERSU teams and necessary equipment. It is recommended to allocate one SEP team comprising of 3 personnel for every 1 lakh population. Existing or dedicated call centers used for sewer or septic tank cleaning can be utilized to manage ERSU operations. Additionally, technical assistants such as engineers specialized in civil, mechanical, or environmental fields with expertise in sewer and septic tank cleaning should be appointed. Step number 3 involves identifying members for the sewer entry professionals teams. These team members are selected from existing sanitation workers who have experience in cleaning and maintaining sewer and septic tanks. It is essential that SEP members receive training in operating various machines used for sewer and septic tank cleaning, such as jetting machines, vacuum suction devices, rodding equipment, and grabbing tools. Additionally, SEP team members must meet specific health criteria. They should be below 50 years of age and free from certain specified diseases. Furthermore, it is mandated that SEP members undergo annual medical tests. If any member is found medically unfit during these evaluations, they are promptly replaced to maintain the team's readiness and effectiveness in responding to sanitation emergencies. SEP members should not have any of the following conditions. These are history of blackouts, fainting or mental health issues, any heart diseases or disorders, asthma, bronchitis or shortness of breath, deafness, chronic skin disease, back pain or joint trouble, a lack of sense of smell, deformities or disease of the lower limbs, conditions that cause giddiness or loss of balance, and serious defects in eyesight. Step 4. Procurement of equipment. This includes safety tripod set, nylon rope ladder, blower with air compressor, gas monitor, full body wader suit, gas mask, airline breathing apparatus, safety body harness, rubber gloves, and polyvinyl chloride industrial boots. These items are mandatory for every ERSU units. Step number 5. Establishing a protocol for ERSU. Representatives from the local body shall request for ERSU to the RSA. This request shall be made only when the machines available with the local body are unable to cater to the requirement. The Responsible Sanitation Authority will decide and approve the deployment of ERSU. The administrative officer will mobilize the SCP team to the location. The RSA will issue a permit for SCP to carry out the manual entry if required. The assigned duty supervisor shall oversee the entire operations on the ground. Post completion of the entry and cleaning of the site, the SCP team will report back to the administrative officer. RSAs must also ensure that a long-term solution is found to prevent manual entry at the same place again. Note that ERSU should be requested as a last resort only after all mechanical means to rectify the issue have been explored. The RSA is the only authorized person to permit manual entry in such scenarios. Step number 6. Training of ERSU. SCP team to be provided with detailed skill-based training covering the following topics. These are hazards related to sewer and septic tank maintenance, confined space entry, work at depths, first aid and rescue, operating equipment related to septic tank and sewer cleaning, work permit, lockout, tagout. Trainings to be provided with recognized institutes only. Such participant to be independently evaluated and certified during the training and to be repeated every year. The last step is to bring a behavioral change in citizen to prevent unauthorized manual entry. This can be done by designing and rolling out awareness campaigns, which will emphasize the prevention of manual scavenging or hazardous working conditions. It should also educate the public on penalties related to the Prohibition of Manual Scavenging Act. In addition, IEC campaigns can also be rolled out to highlight the working of ERSU and call center for septic tank or sewer cleaning such as 14420. It is the RSA's responsibility to ensure such IEC campaigns are rolled out in their respective jurisdictions. In summary, we understood that unauthorized entry into sewers or septic tanks by unauthorized individuals constitutes a violation of PEM SRA 2013. However, in exceptional circumstances where manual cleaning is unavoidable, ERSUs should be engaged. Authorization for human entry into sewer holes or septic tanks lies solely with the RSA within their jurisdiction. SCP must possess the physical fitness and skill to be part of the ERSU. Thank you for going through this session.